evening, everyone. Thank you for joining us. I'm Leah Hollins, the Chair of the Board of Directors of Island Health. With respect and gratitude, I recognize the Lekwungen peoples of the Songhees and Esquimalt First Nations, whose traditional territory I am calling from tonight, and the Nuchalneth peoples whose land we are visiting virtually. I also acknowledge the Coast Salish and Kwakwaka'wakw peoples. Thank you for caring and nurturing these lands and waters. I give thanks to you for welcoming us as visitors to live, work, and care on your lands. I also recognize the Métis, Inuit, and other Indigenous peoples. This is our first virtual public forum to provide the Island Health Board of Directors an opportunity to hear directly from the people and communities we serve. It's an important part of our commitment to transparency and accessibility. Originally, we planned an in-person visit last spring, but the pandemic has changed so many things, including the way we connect with communities. As a governance board, we are responsible for the overall direction of Island Health. We have 10 board members from across the region, including Shawnee Cassavant, who is a Nuchalneth woman from Hupetch'aset and Seshat First Nations. We have a broad range of experience, expertise, and representation from across the region. Ben, from our social media team, will post names of all our board members with a link to their bios and a message from Shawnee on the chat. As board members, we are appointed by the Minister of Health, but the reason we join the board is because we care deeply about the health and care in communities. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, doing what is right for the patient has been central to my work. Because caring for the patient is why I started working in healthcare and why I continue to support the delivery of health and care. This last year has shown us the important role each and every person has in caring for each other, our communities, and our health system. My co-host, the Honorable Josie Osborne, Minister of Municipal Affairs and MLA for Mid-Island Pacific Rim, has been and continues to be an advocate for the health and wellness of the people of the West Coast, and now in her new role for municipalities across the province. Josie, thank you for joining us this evening. We also have Kathy Mcneil, President and CEO of Island Health, Dr. Mike Benusic, Medical Health Officer for the region, James Hansen, Vice President Clinical for the North and Central Island, and Michelle Hanna, who lives in Tofino and is the Director for Alberni Clayoquot, which includes the West Coast region. Tonight's discussion will help the board understand what matters most to those living on the West Coast and gain a broader understanding of health and care needs in your communities. Josie will now provide an outline for tonight's session.
Thanks so much, Leah, and thank you so much to Island Health for asking me to be a part of tonight's event and to help co-host. I'm very excited to be here, and it's nice to look out virtually on what I am imagining is a sea of West Coast faces, and I'm really honored to be joining you tonight from my home here in Tofino in the land, the territories of the Tloquet First Nations. So again, thank you to Leah for co-hosting with me. Tonight, this area that we're focused on is my home and a place that I've been so privileged to live for the last 22 years. Here in the land and the territories, the waters, the forests, the place of the Nuchalneth First Nations. And so from Heshquit to Ahousaht to Tlaoquet to Ucluelethat to Toquat, it's a real pleasure to be here and to join with you and as well with residents from the Tofino Ucluelet Area C of the ACRD area. We are focusing tonight on the West Coast region. So the questions that we're going to be addressing are directly related to this region. And I understand that we may have some visitors who are watching online from other places. And thank you for your patience, and we welcome you to be here. But we will be focusing on West Coast health related questions tonight. So we're going to begin with Kathy Mcneil, the CEO of Island Health, and she will be providing some opening remarks. And then we're going to move to Dr. Benusic, Mike, who's going to provide a local public health update and an update around the community immunization program. So speaking about immunization and vaccinations, I think that many of the people who are watching tonight have been already receiving their first dose. And I will say I did too. I went up to the Tofino Community Hall and it was an incredible and emotional experience. And, you know, it's part of that small town living where when the person who greets you at the door, who takes your paperwork and talks to you, and then who actually administers the vaccination, they are all people that we know. And I want to say thank you right now to every single person who's been a part of delivering that whole community vaccination here on the West Coast. We know that this has been important for First Nations communities, as well as for the communities of Tofino and Ucluelet and Area C. So after we hear from Kathy, we are going to ask James and Michelle and Dr. Benusic, Mike, to respond to questions from you, the members of the West Coast community. And so we will be starting off with a few questions that were pre-submitted, and then we'll move into live questions for those of you who are joining us on Facebook tonight. Leah and I are going to take turns reading out the questions to our three panelists. And if you didn't get a chance to submit a question ahead of time, you can still submit a question now if you're on the Island Health Facebook site. So my friends and colleagues from Island Health are going to do their absolute best to get to all of the questions and to answer your questions tonight. But before we start that, I am going to pass it over to Kathy for her opening remarks. Over to you, Kathy.
Thanks so much, Josie, and thank you for taking time. I know you're so busy, and we are so grateful to you for spending your evening with us and co-hosting this event. And I want to thank you, Leah, for starting us off in our dialogue in such a good way. And I'd like to welcome you all for your time and your attention and your dedication to your health and care and spending your evening with us this evening. I just want to say how proud I am of the amazing team that we have on the West Coast of health and care providers, staff, physicians, volunteers, partners, who all work together to support each one of you as citizens, but also as a collective community in your health. They support you as full-time and part-time residents of the region. And then when we're not in such unusual times, they support huge numbers of visitors who travel from all around the world to visit your beautiful area. The pandemic has brought us together as a world, building understanding and awareness of what we need to do to keep each other safe and healthy. And it may be people who we don't even see, but how our actions contribute to their health and wellness in other parts of this region. The recent successful community rollout of the vaccine in Tofino and Ucluelet, and the rural and remote rollout of vaccine to First Nations communities across this island show how committed each of you are to the safety of your neighbors, your families, and those who are most vulnerable to this disease. Thank you to everyone for taking part in that immunization program and for doing your part to take care of yourself and each other. And I do want to thank you for being immunized. It's a choice you've made, and it's a choice you've made to take care of the collective community. And I think Josie spoke so well to the emotion that goes along with making that choice. You know, the vaccine gives us hope, and at a time we really need that hope. And Dr. Henry says so well, this is for now, it's not forever. And we know we have restrictions now that we are living within, given the upsurge in cases that we've had across British Columbia, and it's for now. We believe with the vaccine, it's not going to be forever. We will see our lifestyles resuming when we get to that place of herd immunity that we hear about. One of the silver linings of this pandemic experience has been our ability to move quickly, to accelerate the delivery of innovation, things like virtual care, to bring care closer to home. And I think that's so important to people who live on the West Coast. I don't think without that pandemic forcing us as a catalyst that we would have adopted those technologies and that option for care as quickly as we have. In the past year, over 170 clinics and programs have joined My Virtual Visit, which is a virtual platform used for a variety of health and care needs, from primary care appointments to health assessments, mental health visits, and specialist appointments and follow-ups. This included COVID-19 monitoring for patients in their homes. As one patient shared, the level of empathy and thoughtfulness from the monitoring nurses transformed what felt like a very scary experience to one that I felt I could manage. Once again, I just need to say how proud I am of the incredible team at Island Health and our many partners who care so deeply about the people that we all serve collectively in the communities. Because health and care starts in the community. It's about working together to identify and develop solutions in partnership at the local level. Health is a local experience. Tonight, I look forward to hearing about what's important to you in your community. And now it's my pleasure to introduce Dr. Mike Benusic, who is one of our medical health officers, one of our new recruits, if you will. And he couldn't have come at a better time. And Mike will provide an update on population health matters in this region. Mike?
Thank you very much, Kathy, and thanks everyone for being here. I will try to be brief. It's difficult to do with so much going on in the world of public health. So I'm going to focus in on just providing a very brief update on the dual public health emergencies, and then an even briefer snapshot on a little glimpse of the population health for the West Coast. So starting, of course, with COVID-19, I looked into the numbers today, and there's actually a really powerful statistic I've heard for the West Coast, that throughout the entire pandemic, looking at it as a whole, the rate of COVID for the West Coast has actually been 2.5 times lower than that looking at the whole of BC, which I think especially for a tourist destination is really remarkable, and to me really shows how the entire community has put their weight behind keeping each other safe. We certainly know that with COVID that there's been a lot of unintended consequences with mental health, income, food security, access to health services. And I think what COVID-19 has really put a light on is everything we do with health, with society, with government, with the actions we do in our communities, is really trying to balance those risks and benefits. One thing that I wanted to mention from the BC COVID Speaks survey is that the West Coast had a very strong sense of community belonging, higher than the BC average. And I think that that's something that's really powerful, and that's likely has helped the community throughout the storm of the pandemic and will help during the recovery phase. For vaccinations, I'm going to address that during the questions. I know there's already some questions submitted about that, so I won't speak too much about it now. The other dual public health emergency, of course, is the overdose crisis. Just a couple of days ago marked the 5-year mark of the drug overdose public health emergency, and last year, 2020, was the worst year on record for overdose deaths within the province of BC. Specific to the West Coast area, typically there's approximately 1 to 3 deaths that occur due to overdoses a year, and 2020 was similar. I mean, I do want to emphasize that every overdose death absolutely is a tragedy, but it is a bit reassuring that there hasn't been a large increase of deaths in the West Coast. Now, this is only one indicator of the burden related to opioids, toxic drug supply, mental health. And we know that there are many that are at risk of addiction and the effects of toxic drug supply within the West Coast area. And we also know that the interventions that we put in let's say more urban areas don't necessarily work in more rural areas. And so it's been good to see over the past year some new measures be put into place to try to meet people where they're at. And if there's questions about that later, I'm happy to speak about it. Quickly, just a bird's eye view of the population health assessment. I really look forward to the time when I can come to the community for a dedicated, hour-long town hall and walk through a lot of the different indicators. But for now, we'll keep it to 1 minute on Zoom. We first look at the social determinants of health, so the causes of illness, and just a couple things we see for the West Coast compared to the rest of Canada. Sorry, the rest of BC, is that we know that there's a higher proportion of owners spending more of their income on shelter, and housing is increasingly of a concern on the West Coast. One of the positive things we see is that there's more active transportation that occurs in the area, about 3 times higher than BC average. Next, when we look at population health, we look at the exposure. So those sort of immediate causes of illness. One thing that is to flag, we talk about the dual public health emergencies of COVID and of overdose deaths. One that's a bit more under the surface is that of alcohol use. And the Alberni-Clayoquot area and the West Coast has particularly high levels of alcohol consumption. And that brings us to the next part of the population health, which is the outcomes we actually see in our clinics, in our loved ones, in ourselves. One thing we see is that the region as a whole, so including all of Alberni-Clayoquot, it has the second highest rates of hospitalization due to alcohol on Vancouver Island and higher than most parts of BC. And what we're seeing is that that's actually been increasing. And I know in my conversations with Dr. Carrie Marshall and those at Tofino General Hospital is that they see a lot of people coming in with alcohol related hospitalizations. On the other side, we see that there's a lower rate of common chronic diseases like diabetes, heart failure, and hypertension. And looking back at those social determinants of health, I think that's something like having higher rates of active transportation could be contributing. Ultimately, what I've mentioned is issues that cannot be tackled just by one person, one organization, one community. It really has to be a all of society approach. And that's why I think it's great that we're having this session to engage, even though it seems kind of strange to say engagement when I'm staring just at a camera right now, but just to see how we can move forward together, really to address not only the outcomes we're seeing, but the exposures and also those underlying determinants that determine if the health of a community and individuals. So thank you very much, and I'm looking forward to the Q&A.
Great, thanks very much, Mike. I'm always fascinated by all of the information that public health has, and quite often they don't get an opportunity to speak about it in the way that they are right now. So I really appreciate what you've said here. The board recently had the opportunity to hear from local island health leaders, Michelle, who's with us, Dr. Carrie Marshall, and Mike, who you've just heard from. The one thing that stayed with us was the commitment you all bring to the patients, families, and communities. This commitment is something we've seen at all levels of Island Health. Now let's turn to the questions. We'll start with some questions submitted in advance, and we'll do our best to get through as many questions as we can tonight. The first question is for you, Mike, from Irvin in Tofino, who asks, is Vancouver Island one region, or do the new travel restrictions mean we are meant to stay in our own part of the region? I'm in Region 2, which is Tofino. There appears to be confusion regarding the regions and the restrictions.
Great question. And I suppose I'd frame my answer in that there's really 2 things we're looking at: what you must do and what you should do. And what the Solicitor General has put through the Emergency Powers Act is that one must remain in their own health region unless it's for essential travel, or else they could face enforcement. So that could be through a penalty of a fine is the most likely thing that could happen in the situation if enforcement was to occur. So that's to say, if someone was to do a recreational travel leaving the island, so Island Health is our health region, and they were go to the Lower Mainland, there is the potential that they could be fined for that. So that's the what you must do, and there's the what you should do. And so nothing has changed now with these with these new regions that have been set up and what the travel restrictions are. The message is still stay close to your home, stay local, enjoy your own back doors, which of course, I mean backyard, and of which on the West Coast you're very, very fortunate to have a very rich one, and to not be traveling within your even within your health region. So the advice is still to abstain from travel that is any travel that is non-essential. But if you travel across the health region into another health region, there is the potential that there could be a fine for it.
Thanks so much, Mike. Our next question tonight comes from Colin, and he is asking about attracting and retaining medically trained persons, from lab technicians to nurses to doctors, in a very difficult housing region, which I'm sure a lot of watchers, listeners tonight can relate to. And he suggests that perhaps investing in staff housing for the long term, followed by recognizing and addressing the rise in demand and use of emergency services seasonally, would be a good thing. So James, can I ask you to take that question?
Great, thanks, Josie. It is a great question, Colin, and it's more of a statement than a question. And I would just say you're right. And health authorities around the province are facing this challenge. We're actually facing it all over the island, not just in the West Coast, in a lot of rural and remote areas like Port Hardy, Port Mcneil, where it's a lack of housing, not just a barrier to entry. We do actually invest in short-term housing, and we utilize that quite a bit, specifically for the seasonal surge for staffing that you mentioned. We are actually now reviewing what it would look like to get into longer-term staff housing, and it is, as I said, it is something as an industry, I think, that we're now starting to discuss as a system across the province. So it's absolutely the right suggestion, and we're on the front end of exploring that. The only other thing that I'd say is that, as part of this, we're actually looking to set up what we're calling internal agency staffing. So we have a large island. We have 27,000 employees, give or take, including volunteers and physicians. And what we're looking to do is actually employ full-time lines of individuals that would be interested in traveling as part of their work experience with Island Health. So there's a potential that you might have a nurse in the region, or a clinician, or a lab, or even a physician for 6 months at a time, and then moving on to another community. So these things are all in the works, and I would like to think by this time next year, we're in a much better position.
Great, thank you, James. So Christine Skoukas has a couple of questions, but before we go there, she wants to thank the great doctors, nurses, and other healthcare professionals on the West Coast. Her first question is around having no doctor available in Ucluelet Saturday, Sunday, and Mondays. She says with only one ambulance, there is a scary thought as she moves into her senior years. She shared she wants to live out her life here, but with no long-term care, no doctor or nurse practitioner, and only one ambulance, it's a difficult choice to make. So Michelle, can I ask you to answer that question?
Sure, absolutely. Thank you for the question, Christine. What I'm hearing you ask is that you really want to stay in community as you age, and that's important to you. We haven't traditionally experienced the same family doctor shortages that have been experienced elsewhere on the island. But we are hearing that with our increased growth in the region, that there is pressure being put on our local clinics. And while our GPs are independent practitioners who set their own schedules, they also provide 24/7 emergency coverage to our local hospital. So as a health authority, we also look to see how we can support and supplement our family physicians. And so we have a few strategies. For example, our primary care strategy that is in partnership with the Division of Family Practice. And we've also been really focusing on team-based care out on the West Coast. And so this means that for those who have chronic or more complex conditions, we're providing a whole team to help support you in your health and care journeys, with the goal of reducing the need for that urgent or acute after hours physician services. And so similarly, in the absence of long-term care options out on the coast, we also have a few strategies to help local residents stay in community or stay in their home longer. So for example, we have increased our virtual care options. We have partnered with the BC community paramedics to provide home health monitoring. And we've really invested in our community health services. So for example, increasing home support, home care nurses, our rehab team, or social work, with the goal of providing individuals the equipment and the services to support you to stay at home longer.
Thanks so much, Michelle. Christine has a second question, and that is around the Tofino General Hospital, which she says is staffed with wonderful people, but it is an aging and crowded building. And we also heard from Arlene McGinnis, who, as many of you who are watching tonight know, is the chair of the Tofino Hospital Foundation. And I hope she's able to access a computer tonight, so she's able to be watching us tonight. And Arlene is asking specifically around the idea of a concept proposal and study for the hospital and what is happening there. So James, could you address what the future holds for the Tofino General Hospital?
Yes, absolutely. Thank you for the question. And it's been a while since I've been up to Tofino to meet with the foundation and have this conversation. Let me begin by saying we have invested significantly in the current infrastructure at Tofino, and we know it needs replacement. And so I would say that Tofino's in one of our top 3 priorities for replacement. And as these investments go, the way this works essentially is we identify any sort of replacement of this nature for our ministry colleagues, and we have done so for the last several years. As far as the future of the hospital, there is some conversation about long-term care and what that looks like in the region. I would suggest that our planning would incorporate long-term care as well as some other pieces that are currently lacking in the area. So I just want everyone on the call here to know we are considering that as part of our planning going forward, and when we hear you. So all I can say at this moment, it is not formally approved as a conceptual plan through the Ministry of Health. We look forward to the day when that can happen. It is one of our top priorities, and we continue to pursue that with our ministry colleagues.
Great, thanks very much, James. We have a question now for Mike from Lori with the Ucluelet Chamber of Commerce, who asks around seasonal workers coming to the coast for the summer. She understands if they are currently here, they can be vaccinated with our community vaccination program. And with many of them arriving in May or June, is there a way that they can be vaccinated in their home communities, understanding that they will be moving here for the summer?
Yeah, it's a great question. And I think it really shows how complex the vaccine rollout is and how many different strategies that are being utilized across BC and across Canada. And for Tofino and Ucluelet and for the New Challenges communities in the West Coast as well, there's been the whole community approach where everyone currently, I think people are probably getting vaccinated a couple hours ago, are eligible as long as they're 18 or over, who are currently residing in the area. And that differs in different areas. So for most of the Island Health region, we're going through an age-based approach, and that's consistent with most of what's occurring in BC as well. And so it would be very challenging to identify who those seasonal workers would be in their home communities to get them vaccinated before they were to arrive in Tofino, because it would be throughout other jurisdictions that have maybe very different vaccine rollouts than we do. And the entire purpose of the whole community approach that's been done on the West Coast is very much a time-limited rollout where we're going in full force, try to vaccinate everyone who's eligible, because we know that in certain areas of Island Health that it doesn't work to provide a continuous clinic where you have an immunizer who's has a dose of vaccine, and then every once in a while, there's like every week there's a new age group that's eligible and they come through the clinic. It wouldn't work for smaller communities because of just the logistics, the operations, the efficiency, and also the fact that when you open one of those vials, you got to use it in 6 hours or else it's going to expire. So there could be wasted doses if you're not doing it on a larger scale. What that means is that really in the West Coast, there are people who were provided their vaccines later because they had to wait outside of the age-based rollout until they were eligible through the whole community rollout. But there are a lot of people who were vaccinated earlier. And so that's why currently within the West Coast region, the vaccination coverage rates are about double that of what we're seeing across Island Health. So across Island Health, it's about 36% and about double that for the West Coast, which is phenomenal. What that means though is that there is a bit of a disparity between coverage rates. And so as much as we would like to have just continuously ongoing whole community rollouts within the West Coast, we do have to balance our supplies to say that, okay, we will then pause the whole community approach. But what we definitely are planning to do now is to come back at some point in May and some point in June to see where we're at with the age-based rollout across the island, and then be able to vaccinate people in the West Coast, in their communities, when they're eligible based on age. So it's not going to be exactly the same with the whole community rollout that we've had. It's going to follow more the age-based and be a bit more intermittent. Plans are in the works for that. And it's good that we'll be starting off in an excellent position in the West Coast where a lot of people have been vaccinated, but we will be getting the rest as we move through the next couple months.
Thanks so much, Mike. I just want to remind everybody who's watching to put your questions on Facebook. If you're in the Facebook event, you can add your questions there. And I think our next question is coming from Mayor Mako Noel from Ucluelet, who has been sharing the ongoing discussions that the District of Ucluelet's been having with Island Health and the Community Health Center idea in Ucluelet, the Community Health Center, which is in dire need of replacement, I would add. And so Mako has expressed that they're very appreciative of Island Health support to forge a partnership to advance their concerns. And he's curious if Island Health can comment on when a memorandum of understanding is going to be brought forward in order for them to be able to secure a building site and move on. So I think this question is probably for you, James.
Seem to get all the questions around finances and infrastructure. That's great. Mayor Noel and I have actually been in contact about this as recently as last week. And just for everybody on the call, I've actually had conversations about this specific health center today with our chief financial officer. So we're not necessarily in a position today to advance an MOU, but we're certainly getting closer, and we look forward to working with the municipality on advancing this. We believe it's needed as well for all of the reasons mentioned in the question. And as we know, it's becoming harder and harder to find space in the community. So we want to get in there and advance this as soon as we can.
Great, thanks very much, James. We are now going to turn to live questions. Thank you to everyone who has submitted a question, and thank you to Ben again, who is monitoring our social media channels and responding to questions online during this event. I think I'm going to put you on the spot again, James. Cindy asks, there is a huge transportation barrier in, whoops, I've lost the question. Somebody's moving ahead too fast for me here. Okay. There's a huge transportation barrier in the region. People who are most vulnerable are those who have no access to transportation. We have been trying to initiate a public transportation system, but it's been on hold since the pandemic. Are you the best person to address that question, James?
That's a tough one. It probably crosses over public health and into the Ministry of Transport. So I think the context here might be, if it's medical transport, I could certainly take that offline and provide the individual with a response. As far as public transport, we do on occasion work with BC Transit to improve transit. So I can look into if we've had any, I guess, involvement in this, but I just don't have enough context to answer that directly, Leah.
Oh, okay, but we will, I'm going to actually comment about how people will get their questions answered if they're not able to do that right here during this live session. But I want to just ask Kathy now, if she would mind adding, this goes back a question or two about when Mike was speaking about seasonal workers. So Kathy, over to you.
Sure. Great. And I can actually say something on James's point about transport. So, but just on Mike's question about seasonal workers, and this is how quickly things change. So we have a plan, and then life happens, and then we adapt to the plan. So we exactly as Mike has described, many of you know there was quite an outbreak in Whistler, and many of the workers in Whistler will come to Tofino to work in the summer season from the winter season in Whistler. So thankfully, within the intervention in Whistler, they took a whole community approach to deal with the outbreak and have done a really good job bringing down the case count. And so some of those workers who would be coming to Tofino have now been vaccinated as a result of their work in Whistler and their association in that community. So this is how we're all connected, and connected in how this vaccine program actually has some other, I guess, added benefits that we don't necessarily see up front. So just to the transport question, I recall meeting with the community health group a couple of years ago, and this was raised. And one of the things that strikes me is an opportunity to let people know that we have community health grants, and we have a process, an intake on an annual basis where community groups can come together and put in a proposal for community health grants. Now, it doesn't usually buy infrastructure like buses or but it may provide some opportunity for funding with respect to some of these social determinants of health that Mike has outlined. So I just wanted folks to know that that's an opportunity as well that we offer every year on an annual basis. And I think, as Leah has said, we can make that information available to you in terms of the cycle time of when that grant process opens up for application.
Great, thanks, Kathy.
Thanks, Leah. Thanks, Kathy. That's fantastic. We have another question, and I think we'll direct this one towards Mike again. This question is from Janice, and she is wondering, even though we've had a whole community vaccination program here on the West Coast, of course, a little bit broader on Vancouver Island, we know that AstraZeneca has been made available to people first 55 and older and then down into lower ages. And so Janice is wondering when we're going to get our 30 plus or even 40 years plus AstraZeneca program running up here on the island.
Yeah, and thanks for raising this. And I believe Minister Dix a few days ago was asked the question about when within Island Health will we be seeing more AstraZeneca, and his response was that that we've received all that we will receive for some time, and that, as you've mentioned in the question, that the rest are going to be triaged to areas with higher case counts. And I really think that this is reflective of what my boss, Dr. Stamik, really refers to as the one system approach, that we are, within BC, we're supporting each other. And we are really at a very different situation. I really can't stress how different it is compared to our current situation with COVID and that of the Lower Mainland. And just one stat of this is that the rate of COVID on the island compared to the Lower Mainland, it's about 5 times higher on the island. The hospitalization rate is about 4 times higher, and the ICU admission rate is about 6 times higher. We are incredibly fortunate that we've had one of the best COVID experiences throughout Western Canada, if not like all of Canada outside of the territories in Atlantic Canada. I think that really is reflective of just all of the efforts from everyone in society of what they've done to keep our case counts low and keep each other safe. I also think that our moat surrounding us has a bit to do with it, so beneficial for that. But I can understand why there's concern that a vaccine perhaps is not being distributed in a strict per capita allotment to the different health authorities. But I really think, from my professional medical opinion, that putting the water where the fire is protective for everyone. Because what we have certainly seen throughout the COVID-19 experience on the island is that when the rate of transmission increases in the lower mainland, we have a bit of a delay, and then we have an increase within island health. It's because there's travel, there's transport between those areas. We are one province. And so if we can focus on those areas that are the hotspots, that'll actually end up being beneficial for island health as well.
Great, thanks, Mike. Before I go on, Josie, do you want to go back to the public transit question?
Oh, sure. Thanks, Leah, so much. So yeah, with respect to public transit, I think a lot of people who are watching tonight will remember that the Alberni-Clayoquot Regional District has a proposal for public transit in between Tofino and Ucluelet. And so although COVID-19 and the pandemic has delayed the plans for that a little bit, I would definitely suggest that you get in contact with the regional district directly, which you can do at mailbox@acrd.bc.ca and ask for an update, or speak to your local representative. So in Tofino, your representative is Tom Steer, and in Ucluelet, your representative is Rochelle Cole, who is also one of our paramedics and frontline workers. Thank you, Rochelle. And as well, the Monolith Nations have representation there too, through the Tokwat Nation and through Ucluelet as well. So I'd encourage you to reach out to the ACRD to get an update on that. Thanks.
Excellent, that's great. Thanks, Josie. So Michelle, I'm going to put you on notice that I'm going to ask you this question about racism. Cindy wants to ask a question around racism amongst healthcare staff at the hospital due to the recent very public occurrence of an elderly lady from a housing who experienced extreme difficulty accessing care. What is being done to address the personal bias amongst hospital staff who are responsible for ongoing racism? And at the same time, I'm going to suggest that Kathy may want to jump in here as well. So if you want to start, Michelle, and then we'll see what Kathy wants to add to it.
Yeah, sure. Thank you, Cindy, for raising this very important question. And racism and systemic racism is certainly something that we know our communities and our patients experience when they access healthcare services. And so at a local level, we have a few different initiatives underway as part of our cultural safety training and our commitment to improving cultural safety through our department, our emergency departments, but in accessing our healthcare system as a whole. So for example, we have made the commitment that all of our hospital staff will complete the SANIUS training. And so this was initially initiated for our emergency department staff, but we took that one step further and ensured that all of our staff working on the West Coast had this training. We also have a cultural safety committee out on the West Coast, and this is where Island Health and can sit at the table with the health directors from the 5 nations and hear directly about the experiences and priorities of our communities and our nations. And then we can work together on joint projects to improve our services and improve access for our First Nations communities. We also have Aboriginal liaison nurses who will work with our Indigenous patients and families and liaise with the various partners and service providers to help smooth these transitions and improve their care experience. We also have been working closely with our First Nations Health Authority on projects in community, and as well as creating partnerships with our NTC nurses, which is the New Chalmouth Tribal Nurses, who also work in community, and forming those relationships and seeking feedback on the care that we provide, and trying to work in partnership to improve the health and the access for community members across our region.
Great, thanks, Michelle. So Kathy, you were going to add something to that.
Sure, and thank you, Cindy, for and naming the problem. So the first step is to name the problem, and we at Island Health take the experience of Indigenous patients and families very seriously. Systemic racism of any form is not acceptable, and it's leadership's job to deal with the systemic elements of how racism impacts care. And our board has been very clear with us of their expectation of us to do this work in partnership with the Indigenous nations and peoples. So we've developed an Indigenous health team under the leadership of a Vice President, Don Thomas, who's was quickly seconded to the Ministry of Health to do this work on a provincial level, but we await her return, and in her absence, Krista Allen, who's our chief nurse, is providing excellent executive leadership for the work at a system level. We are, as Michelle said, there are a number of cultural safety training experiences, but we know from the in plain sight review that the work we need to do to check our own biases, the 8 forms of bias and discrimination that people have experienced in the health system, that's not going to be addressed through an online training program. We know the work we need to do has to have a local connection. So we are working to adopt a model that's being used in Northern Health that has a piece around history, a piece around self-awareness and self-reflection, a piece around local traditions and cultures, and a piece around traditional medicine, because that's the other area that we in the Western medical world need to open our minds to traditional healing. So that work is happening. We're also the unfortunate case of the lady from Mahouset who really didn't have supports to navigate as she was trying to recover and monitor her COVID-19 symptoms. We identified the need with nations, and in particular on Saanich Peninsula, the 5 nations there, the need for Indigenous peer navigation. And so we have 5 positions that have been approved for each health authority in British Columbia. Our first peer navigator is being implemented next month here on Saanich Peninsula. But the intention would be that we would have 5 of those roles across the island, working, as Michelle said, as part of the cultural safety connection from the local nation and Island Health. So the Aboriginal health nurse really speaks or does the work around coordinating care and services, but the navigator is a support and advocate for the individual and family going through the system. So there's a voice, and they're not alone. This is important work, and it's going to take us some time because there, as James said, there are 25,000 hearts that need to be touched in a way that we can understand how our behavior expresses discrimination. And so that is work that we are fully leaning into and taking very seriously as the work ahead around our cultural change.
Thank you so much, Kathy, and thank you, Michelle, for taking on this important question, and Cindy for asking it. We are going to turn to our next question, which comes from Julia, and I think this question is best directed at Dr. Mike again, and it's around the suitability of vaccinations for pregnant women. Mike, could you address that?
Certainly. In terms of suitability for vaccination amongst pregnant women, I mean, we definitely, as Island Health and as the BC Centre for Disease Control and the Society of Obstetricians and Gynecologists of Canada, certainly recommend COVID-19 vaccination for those who are pregnant. It certainly has while the vaccines haven't specifically been studied in those who have been pregnant, everything appears as expected that the benefits of the vaccine far outweigh any theoretical risks there could be, and there has not been found to be any actual concerns as with pregnancy or breastfeeding with receipt of the vaccine, which is what we would expect for most vaccines. The only vaccines we don't provide to people who are pregnant are ones that are live. So that's, for instance, measles, mumps, rubella. However, again, that's just from a theoretical basis. Specifically on pregnancy, I guess in regards to eligibility, there's two different categories for eligibility. One is medical eligibility. So anyone who is pregnant, certainly it's their choice. It's anyone's choice if they want to receive a vaccination. And so as long as they meet the minimum age requirement of 18 or older, that if they're pregnant, they can receive a vaccine when they're eligible through the rollout. And that's the other eligibility category for every condition really, is when are they eligible through the provincial rollout. And right now, pregnant people are not prioritized specifically, other than those who have heart conditions that require them to see a cardiologist. And how that was identified was through the Provincial Health Services Authority looking at what they call clinically extremely vulnerable conditions, what actually increased the risk of someone having severe disease, hospitalization, death if they were to get COVID, and that was identified as one. At that time, when they did the review, it wasn't identified that pregnancy in general would increase the risk. However, what they do is they continually look at what the data is coming out from different jurisdictions around the world to see if there's other conditions that should be prioritized. And so that's the current situation when it comes to pregnancy and vaccination.
Great, thanks very much. It's way more complicated than people understand at first blush. The next question comes from Carly, and her question is about the lack of lab services, which is becoming a pertinent issue on the coast. The new system of online booking is limiting to those without access to internet or smartphone services. How is this being addressed, and is further staffing coming? So Michelle, I'm going to ask you if you would answer that, and then I'm just going to add a little something to it when you're finished, if you haven't already said what I want to add. Thanks.
Okay, sure. Thank you. Thank you, Leah. And thank you, Carly, for the question. And, you know, I'm really sorry to hear that we're finding barriers to accessing lab services, because I do know how important it is to your health and well-being and care plans. So I'll kind of speak to two parts of it. One is around the appointment booking system. And so as part of the COVID response, and in order to support physical distancing in our waiting rooms and to reduce the crowding in waiting rooms, lab services did implement an appointment booking system in various sites across the island. This isn't necessarily something new for our region. UQLit Lab has been an appointment system for a few years now, and feedback has been overall fairly positive. However, with this new implementation into Pheno, we are hearing feedback from both community members as well as our clinicians that there's some challenges around this. And so we have been meeting with lab services even as early as this morning, but we're really committed to taking that feedback and refining the process to find a solution that works well for our community members as well. As you know, some of it might be a bit around, you know, being comfortable on how to use this system, because there is certainly the option. You don't need a smartphone and you don't need a computer in order to be able to book an appointment. You can use the telephone and phone the lab from a landline and book an appointment that way. And you can also walk into the lab just like previous, and there are some walk-in spots every day as well. And again, you don't need any technology there. You can just walk up to the front desk and say that you need lab services, and they will assign you a number in the system as well. Yeah, we are committed to making the system better, but do recognize that there has been some growing pains there. The second piece speaks a little bit to shortages. And sometimes we have seen that lab needs to close on urgent notice because of staffing shortages. And this is not unique to Tofino or Island Health. These are effects of provincial and even national shortages. So again, we are working hard on our recruitment and retention strategies, but these are certainly a lot bigger than our sites as well.
Great, thanks very much, Michelle. And the other part of that, I guess, is having to wait outside. It looks like there's not much cover for people if it's raining, which it often is here. So I don't know whether you have been able to address that question or not.
Yeah, we've tried a few different methods, and I think this was part of the reason for going to an appointment-based system as well, and so that we didn't have people kind of waiting either outside or inside, and then people could just show up when their appointment, and they knew they could just walk right in. So certainly more to come there as well. We have explored a few other options around, tents or such, but our West Coast weather just isn't that conducive to those kind of models, but certainly something we are looking for.
Thank you so much, Michelle. Our last question, and unfortunately this is our last question from tonight, comes from Jason. And Jason asks, what percentage of the population would be required to obtain the herd immunity status? And do you think that BC will hit that percentage with the folks who do refuse to take the vaccine? So Mike, I think this one is for you.
Yeah, certainly. Thanks, Jason, for the question. Rough estimate about herd immunity levels would be probably about 70 to 75% of the population having received vaccine. I'm actually very, very optimistic we will reach that level, because we cannot be giving out vaccines quickly enough. People are we're not seeing hesitancy in the populations that we've been providing vaccines to, especially within Island Health. Right now, our vaccination coverage rate for those who are above the age of 80 is about 95%. And I've seen from Tofino that there's been an excellent uptake in vaccines. The one thing I want to just put in perspective is about what that actually means in terms of herd immunity. So COVID is not something that is going to disappear. It's probably going to be with us forever. It's going to continue mutating. There's going to be different variants. We may need to have booster vaccines in the future. But the one thing that is really, really optimistic about vaccines is that while they may not decrease the risk of transmission by 100%, they nearly 100% decrease the risk of severe disease. So if we vaccinate many people, even if we don't reach a herd immunity level, so we have these outbreaks of COVID that pop up in the future, if the majority of people are vaccinated, what that would mean is that the majority of people may have symptoms of either no symptoms or symptoms that are mild and cold-like. So if the notion is of herd immunity eradicating COVID, it's probably never going to happen. But the sense of herd immunity to reach a level of being back to normal absolutely is going to happen.
Great. Well, thank you very much for that. Unfortunately, someone said at the beginning that this hour was going to go by very quickly, and it certainly did, because here we are at the end of our time already. And so I'm just going to ask Kathy to say a few closing remarks before I wrap it up.
Well, I just want to thank everyone for your very thoughtful questions. And it's very, very clear how committed you are to your health and well-being and that of your community. And we have heard you. We've heard you on about the lab. We've heard you about the hospital. We've heard you about transportation. And we've heard you very much your advice and questions around vaccine and visitors and seasonal residents. And so this has been a very rich dialogue, and I very much appreciate the time, and it will help us do our jobs greatly.
Great, thanks very much, Kathy. Before I close today, I too want to thank my co-host Josie, panel members Mike Benusic, James, Michelle, and Kathy. This has been a really interesting evening, I think. What someone commented about was that people need right now to have transparency and communication. around the vaccine rollout, and I hope we've given that to people tonight. We won't be able to do this again soon, but we will look forward to when we can. We really appreciate those of you who submitted questions in advance and during the event tonight. If we didn't get to your question tonight and you want to follow up, please reach out to us by email to asktheboard@vha.ca, and those are all small letters. Thank you to the staff, physicians, clinicians, and partners who continue to approach health and care with compassion and commitment. And thank you to the community for participating, and for those who continue to follow the public health guidelines and who have participated in the immunization program. There is one more clinic scheduled tomorrow in Ucluelet and on Thursday and Friday in Tofino. And I encourage you to get vaccinated and add an additional level of protection for each other and the community. Thank you very much for taking time to join us tonight. And that concludes our event. So I hope it was beneficial to all of you as it was to us.